Good evening. It's another Sunday. This is Facts of Health. We are live on ATV. We are streaming live on Facebook. Search Facts of Health or join us on ATV Ghana Facebook page. You can follow us on all our social media handles: Facebook, Facts of Health; Instagram, facts.of.health; Twitter @FactsOfHealth1; and subscribe to the YouTube channel Facts of Health. Last week we skipped it. This week we are back. I know you are excited. I'm also excited. We are ready to learn. So stay glued to your seat. You can join the program by sending your messages through 0204 391417. 0204 391417. Only WhatsApp. You can also join us on Facebook and send your comments there. Stay tuned. I'm Na Edu. If you just tuned in, this is Facts of Health. We are live on ATV. We are streaming live on Facebook. Search Facts of Health or join us on ATV Ghana page. You can also follow us on all our social media handles: Facebook, Facts of Health; Instagram, facts.of.health; Twitter @FactsOfHealth1; and subscribe to the YouTube channel Facts of Health. I have Dr. Bernard Togo. He's a consultant urologist from Kolebu Teaching Hospital. Today we are delving into men, infertility in men. I promised you last week, we missed it, but I know you are glued to your seat waiting for what we are all ready to learn. Anamebwa. No asomanye. Oh, welcome, I feel Papa. So today is infertility in men. Dr. Tobo, welcome to the show.
Thank you very much indeed.
My viewers have been craving to listen to anything because we've done infertility in women and they are all waiting.
Right.
That men on the young can answer man and there
should be a balance.
There should be a balance.
Sure.
Gender and then gender balance and gender equality.
You have to cover every
Welcome once again. You are looking good.
Thank you very much indeed.
Thank you for coming. You are always there for us, and Facts of Health is always grateful. Don't forget to keep voting for Facts of Health. You can send SSI to 1736, SSI 14 for Health Advocate of the Year, or SSI 10 for the show to win the award for this year. Voting ends on 11th of November, just this Wednesday. So keep voting. Manenko bebe 2 city 3 city na more voting. Dr. Tobo, you have go straight.
Right.
In time minimum say na yin to me, but my viewers no more ready.
You're ready for them.
Yes. So what is infertility in men?
So when it comes to infertility in general, you realize that in our society, much of the blame is put on the women. Naturally, when the woman is not able to conceive after marriage. But the statistics have shown that there are factors which you can attribute to men. So basically, infertility in men is essentially the inability of a man. The inability of a man to impregnate the wife after 12 months.
After 12 months?
12 months of regular intercourse. After 12 months of regular intercourse. The word regular is very, very important, because there are some people who come to the hospital with infertility problem, and you realize that
regular, no.
They are lazy people. They don't do it regularly as you will expect. So,
okay.
And we use the 12 months is a statistical derivation in the sense that the probability of you conceiving in the first month of marriage is about 25%.
It's about 25% in the first month of marriage. And so no fresh.
Well, sure, but some people. I mean, God is gracious to them, and they are still able to. As you continue with your regular, sex, by 6 months it climbs up to 75%.
Oh, okay.
And then by 12 months it gets to 90%.
Wow.
Yes, and that has been validated in various places. So when people come 1 month, 2 months, 3 months, we try to assure them that they should continue.
They should continue.
Yes. So you realize that for the male factors, they contribute 50%. The female also 50%. So the fault is not wholly that of the females.
You know, a setting, it's always the woman that is in trouble.
Yes, the woman is the first one to be blamed. It's cultural.
It's cultural.
Cultural, yes. And there are a lot of things that that happens that beats the eye. If the man looks well nourished, well built, is having an erection, it is assumed that he is fertile.
He's fertile.
But it is not wholly so. A man can even be ejaculating semen.
And there's nothing.
There's nothing inside.
Hey.
What we call, water, river without fish.
Wow.
If the sperm is the fish, and the semen is a river.
Nani.
Some people can be bringing out, flowing river without,
So the fact that there's flowing river, his mind is he has to
he thinks that he is fertile.
Okay.
Things that is fertile. So the blame is mostly put on the women. And
but is there any statistics to this? Do you have more numbers in the men recording infertility?
Well, as the years go by, I think it has to do with industrialization, and then even the kind of foods that we eat. Some are not purely organic. You have a lot of chemical inputs, here and there. It has been found that over the past century, on the average, the sperm counts of men globally has dropped.
Wow.
It has dropped because of all these influences.
Okay.
And like I said, industrialized societies, we are getting in touch with so many toxins, so many unusual, radiations, etc. All these things, input into the dropping statistics.
Okay. With all that you've mentioned, it takes us to the causes. Or is it causes or risk factors?
Sometimes we use it interchangeably. We use it interchangeably. Before we come to that, you realize that for what will cause the woman to be pregnant, essentially you have the sperm meeting with the egg, and then there is fertilization in essence.
Yes.
So for the particular spermatozoa, you can have different issues. Either the count
for one or another.
I mean the spermatozoa in general.
Okay.
You can either have the count being low, or you can have a problem. You can have a normal count, but there's a problem with the shape. Ideally the sperm should look like a tadpole, and that's a streamlined shape. But that is the same technology that these automobile companies use in designing their vehicles, so that the resistance whilst the drive is less. So the normal spermatozoa should be shaped like that, like a tadpole, so that it can swim with
easily
minimal resistance. And then you can have a shape problem, you can have a count problem, and then you can have a movement problem, motility. Yes. So we don't just take the count in isolation. Somebody can have a normal count, but the normal count, they can't swim very well. And then you have some people who don't have even sperms at all, what we call azoospermia. And that is where the causes come in.
Okay.
Yes. I prefer to look at the causes because of our viewers. I don't want to use outrageous outrageous terms. So just for everybody to understand, we look at it this way. The sperm is mostly produced within the testicles. So that is a factory. And then when the sperm is produced, like any good or any factory product that is produced, it has to be carried and conveyed to a depot, a storage site. So you have a channel, the special tube, where the sperm would pass for it to be stored. And then when it is required, then it is released adequately during sex. So you can have a problem with the factory, which is the testis. You can have the problem with the road channel. If you have too many roadblocks, you have so many potholes, you have, trees falling on the road.
On the road.
That means the goods cannot be carried across.
Yeah.
In other words, if the tube, the special tube, we call it the vas, let me call it vas, simpliciter. If the tube is blocked, or there are factors within it which make it unfavorable for the sperm, to swim, then you can have a lot of sperms being produced, but they are bottled up in the testis.
Hey.
Now
They don't move at all. They are just there.
because there's obstruction.
Okay. Okay.
There's obstruction, and then sometimes obstruction may not be within the tube. It can be far away from the tubes. Let's say within the prostate, or even the tube within the male organ, what we call the urethra, something we call urethral stricture.
Yeah.
So any place along the line where there is a blockade, that can affect, the quality of the sperm or what comes out. And so I talked about the factory, and I talked about, the conveyor belt. And then we have other external factors or factors within the body which sort of creates the enabling environment. So let's say you produce your goods and you are transporting it and you don't have adequate security. So somebody can,
Just come
waylay
and then
you and
cross
then
you.
take your
Yeah.
goods away, etc. So if the government doesn't create the security, that's the analogy I'm making. So within the body, if your hormone levels are not good, if you have certain medical conditions, chronic conditions, remember testosterone is a protein. And if the main organ, the liver, which produces the protein, is defective, if you are somebody who doesn't take adequate amount of protein, for instance, those who are pure vegetarians, yes, they can have issues like that. So that enabling environment too is very, very important. So that is a nutshell. If we have to go specifically,
Yes.
then the various terms will come in.
The various terms will come in.
Yes.
So that's causes for the you specified it, classified it to
Yes.
the aspermatozoa or
Azoospermia.
Azoospermia.
Azoospermia means
Yes.
there's
no
sperm in the
yes.
semen.
Yes.
So no fish in the river.
Okay.
Uh-huh.
So there can be risk factors that can lead to infertility.
Yes. So if we have to come specifically to what may cause the various abnormalities that I talked about, coming back to my analogy, if there's problem with the testis, which is the factory house, and the problems can be primarily, intrinsic to the testis or coming from outside. If I say intrinsic, let's say somebody develops a problem with the testicle, chronic infection.
Okay.
That can be an issue. If somebody develops what we call torsion, torsion is when the testicle gets twisted. So the blood supply to it is affected and can make it die in quotes, and that can affect the fertility. It tends to occur to boys in their teens or young adults.
In their teens.
Yes. So most of the times, and viewers, we always advise our mothers, our parents, anytime a young boy complains of pain in the testicles, you should take it serious.
Normal.
You should take it serious. Either some of them, there may not be any trigger.
Okay.
I remember there was this young boy who was washing the father's car, and extremes of temperature has been found to be one attribute. The water was quite cold, and I think that was the trigger. All of a sudden he started feeling pain within the testicles. Sometimes too, the pain may not be directly down there. You may feel it in the lower abdomen. So in general, pain in the testicle, a boy complains about pain in the lower abdomen, check the testicles. Let's make sure that it is not swollen or tender, or better still, let a professional look at it. That is what we call torsion. Very, very important.
That's a very important.
Yes.
Before
very
we end, you would have to. Oh, they see do you. Yes, you would have to repeat it for our mothers especially, because they bath the kids most of the time. They are with the children most of the time, so they are training. So these things we just take it as normal. That I share They'll
give you some paracetamol.
Yes, they'll give you some paracetamol and then you're home. So if we can really intensify that, I think it would really help. Yeah. So moving on.
And then you can have what we call varicocele. Varicoceles are, where the veins around the testicle becomes abnormally enlarged. Now the veins are supposed to carry blood back to the heart for recycling.
Okay.
But if it becomes abnormally large, then blood pools around the testicle. And what does that cause? The blood, raises the temperature around the testicle. Remember, the testicle or the testis is originally an abdominal organ.
Okay.
But when the baby is born by 9 months, then it descends in the scrotum. And it's for a reason. It's for a reason. The temperature in the scrotum is about 5 degrees less than the body temperature.
It's
about 5 degrees less. And it is for a reason. Sperm production doesn't like heat.
Okay.
Sperm production doesn't like heat. So those dilated veins create a kind of hot situation, hot environment around the testicle. The same, situation applies to anything that will increase the temperature around the testicle. I'm talking about acquired reasons here.
Yeah, yes.
So people who tend to wear multiple, underpants. But back in the day when you're going to school and you are afraid of punishment.
Then you pack yourself.
You pack yourself. People grow up with it, still packing themselves. It's not a good habit.
Okay.
Ideally, for young men, we advise also that they wear panties which are white. Dark colors tend to trap a lot of heat.
Wow.
Yes. So it should be white, it should be cotton.
Okay.
It should be just fit, not too tight.
I know what tight.
You're penning them. So cotton, not latex. It should be white.
Okay.
Some people wear other colors because they want to wear it several times. Boys in general, we don't like that.
Boys?
They want to wear it several times.
Yes.
They should wear white.
Okay.
So that you won't have too much heat. Yes. Heat around there.
So they wear the panties, they wear boxers, and they wear shorts. Only a packing, and I'm
No. Just wear your underpants, and that should be it.
And that should be it. Okay.
And then we also don't encourage people to be sitting in bathtubs, jacuzzi, or mini jacuzzi. Very hot.
Okay.
Yes. Otherwise, you are frying your tadpoles.
Wow.
Yes, you are frying them. In general, for me, I belong to the school of thought which advise, people who are having fertility issues in general, that they shouldn't even be taking hot baths.
Wow.
If you have to bath, it should just be lukewarm. Just be lukewarm.
Okay.
Also, bringing a lot of things that produce radiation on your laps. Laptop, for instance, is called laptop. But I advise that you shouldn't put it on your lap. Yes. Put it on your table or put it on a very hard, textbook, because it produces
heat.
Yes. Yeah. And regular, exposure, you are doing things to your to your generation.
Wow.
Yes.
These are all acquired.
Yes. Mobile phones, even putting mobile phones in your
pocket.
Trousers pockets, especially if it is low battery. It tends to emit a lot of. So those things can create heat-like situation around the testicle, and that would affect the testis' ability to produce, the sperm.
Mm-hmm.
Then when we come to the blockade, commonly infection, sexually transmitted infection, especially gonorrhea, chlamydia, those ones are very notorious for causing reactions that at the end of the day cause scar tissue.
Okay.
Scar tissue to form, and that causes blockade of the tube from the testicle all the way towards where the prostate is. Those same infections can affect the prostate. So you will have.
So it's connected.
Yes, it can be a continuum.
Wow.
Even right from the bladder, those genital organs, the prostate, the vas, that tube, even the testis. So you can have a whole continuum if it's not treated very well.
Wow.
And sometimes we encounter young men who come with prostatitis.
Oh no, yeah, bad.
Prostatitis, no. To explain it in a simple term, it's like you having a sore in your prostate.
Okay.
Yes. So the technical term we use is inflammation. Something has the organ has been set on fire. So if you have infection irritating the prostate, for instance, then the prostate tries to heal itself. You have a lot of scar tissue forming within. And remember, the prostate is one of the organs which helps the sperm to mature, to get a lot of capacity. Oh, here, papa. Just that when you start growing after 40 and the rest, that's when
it's not really.
It starts becoming big and causes
trouble.
Yeah, prostate problems. But young men who have prostatitis can also have fertility issues. Can have fertility issues. So those are some of the things
that. No. But are there stages or types? Mekan there types, okay. Infertility, when it happens, is it just once? It's infertility, or there are stages. Oh, this is semi. We heard that in the women. So secondary infertility.
Right. So, if I will come from that angle, primary, secondary infertility. Primary means that you've never impregnated a woman before.
Okay.
Secondary means that probably you've impregnated before. Either the woman had a miscarriage, or you terminated, or the pregnancy couldn't get to term. That means at least you have a good history of what that you can impregnate a woman. So that's secondary. That gives it more. That gives a lot of hope.
Okay.
Actually, yes. But coming back to the types that you talked about, that was why I made mention of the fact that you can have various abnormalities of the sperm.
Yeah.
So you can have some people who just have a count problem. It is a count which is low. So we tend to refer to those patients as having oligospermia. Oligospermia. So oligo means what? Few.
Okay.
Yes. So few sperms.
Okay.
Then those who have, shape problems. I talked about the normal sperm looking like a tadpole.
Yes.
Some can have abnormal shapes. Big head, short tail, coiled in neck. All these things can cause, the sperm not to function very well. And that one is called teratospermia.
No, sperms no yare.
No one samay. Teratospermia.
Okay.
Then we have those in whom the sperm cannot swim at all.
Okay.
Yes.
They are there but cannot swim.
They cannot swim, or they are sluggish.
Okay, they are very lazy.
Yes. So that's astenospermia. And you have people who have a combination of all this. So oligo, asteno, teratospermia.
All the one person can have
an
all
abnormality of all these three. Oligo, asteno, teratospermia. What we call the F.O.H syndrome. F.O.H syndrome. And that tends to have the prognosis tends to be quite poor. Those are the people who gravitate towards, assisted fertilization. Then there are people who don't have sperm at all.
They don't have at all. They don't produce.
They produce semen. So when they have sex with their wives, the semen would appear.
Okay.
The semen will appear.
That is what you said, river without fish.
There's a river, but
me a good student too.
Yes. There's a river, but there's no fish. Yes.
Okay.
So those are the various those ones are called azoospermia. A means without.
Without.
Yes,
okay.
azoospermia. They tend to be they tend to have severer issues. Yes. They tend to have severe issues. Coming back to some of the risk factors, I forgot to mention that sometimes everything can be normal.
Okay.
Everything can be normal, but if you are not having adequate erection to deposit, the semen or the sperm, or sometimes you have sex, and instead of the semen and the sperm coming the normal way, which is down the channel, and it appears outside, the semen containing the sperm rather moves into the bladder. What we call retrograde ejaculation. So there are situations like that.
So the man wouldn't see the semen at all, or
either
he would feel it, but it's not out.
Good. So some experience what we call dry orgasm.
Okay.
They will have sex, but
nothing.
But the woman will say that, Master, yesterday did you pass somewhere that you are dry? And that's where sometimes marriage issues can come in.
Okay.
There are problems down there. It's not as if the man went somewhere. So either the outflow channel is blocked, so the semen is not coming out, or it went in the wrong way into the bladder.
Wow.
And it's very common among diabetics. Very common among those who have diabetes. Yes.
Okay.
Yes.
So with them in the VAS that you talk about, the VAS is not working, or the VAS is there, but
the VAS is there. The VAS comes all the way to connect to where the prostate is. So along that line, you can have a blockade. Sometimes there's no blockade. During the normal, act of sex, when you're about to release, the bladder has to close.
It has to close?
Yes.
Oh, okay.
The bladder has to close so that everything will come down.
So if the bladder opens?
Good. So diabetes, for instance, their bladder tend to keep open. And then those who have prostate issues and are taking prostate medications, some of the prostate medications causes the bladder neck to open perpetually, obviously, so that you can urinate better. But in so doing, when you have sex, the thing tend to move. So later they will pee it out, and some will tell you that their urine is looking a little cloudy or a little whitish. It's because the semen went into the bladder. Into the bladder? Yes.
But on your
Debbie,
it will just stay there until you pee.
Exactly. It's a natural AE. So if even you don't pee it out, the system will absorb it.
Wow. But I want to show like midrange when you
actually, yes.
Actually,
the normal process of sperm production by itself, it takes about 75 days to produce one sperm. Of course, they are produced in billions.
In billions.
Yes, or in millions. But it takes about 75 days. Then when it's produced in the testes, it will take about another 2 weeks for it to be transported along the tube, the vas, towards the storage site.
Wow.
Yes. So in total, in front of there, about 3 months.
75 plus 2 days.
About 3 months for the regular. That is why we advise people to adequately eat very well, proper food, proper nutrition, so that process is enhanced.
Okay.
I'm sure we'll come to that.
Yes, we'll come to that. So we are discussing infertility in men. I'm with Dr. Bernard Tobo. He is a consultant urologist. Yakoba, mema wacho, native urologist na seche. So just stay tuned. We'll be right back. I'm Naidu. Thanks for watching. This is Facts of Health. We are live on ATV. We are streaming live on Facebook. Search Facts of Health or join us on ATV Ghana. You can always follow us on all our social media handles: Facebook, Facts of Health; Instagram, facts.of.health; Twitter @FactsOfHealth1, and subscribe to the YouTube channel. Don't just check us out there. Like, follow, and share the page for other people to also watch. If you are watching us live on Facebook, share for people to join in and watch so that they can bring in their questions. Dr. Tobo, your questions, baby. Baby, yenvi discussion numpo, yasha simple. Yenju baby ya. Onye easy. So we'll open the phone lines later on, but you can join. You can send your messages through 0204 391417. There are lots of messages Dr. Tubo will go through. We'll take them one by one, just a few. But we would have to finish the discussion up to a certain point.
Sure.
Yes. So we're talking about the causes, then the risk factors. You've spoken about the semen returning. That is very, very key to me. How semen can return to bladder and all that. So we're speaking about, but are there signs that can tell a man that there's something wrong?
Yes and no.
Yes and no.
Yes. So let me start from the no part.
Okay.
Somebody may look absolutely normal, and we always and that is what sometimes make them more, depressed, because they don't see anything wrong with them, obviously, and then only for them to get married, and then there are issues.
Maybe 10 gramo. No fair or one day. No, yes.
Firing, blank bullets.
Easy.
Yes. But for some people, they may look normal on the outside, but when you check the genitals, that is when the abnormalities may show. For instance, if you've ever had, torsion before, with torsion, like I said, the testicle, gets twisted.
Yeah.
And when the blood supply is affected, ultimately it starts to shrink. So those men, when you examine them, or they themselves would, report to you that they've realized that their testicles, either both of them or one of them, is getting smaller than usual. And sometimes it may become softer. It may become softer than is required. So that is one aspect. I talked about those abnormally dilated veins, those varicocele. Sometimes they can see it if it is quite severe. And the simple term that we tend to use for the varicocele or those dilated veins is we tend to say that it looks like a bag of worms. So when you touch it, it feels as if you are touching, worms in a bag. Yes.
Oh, okay.
Yeah. That is how it appears. Then also, especially with those who have genetic issues, they tend to be in the minority.
Okay.
But people like that may have some features which may give them away. May give them away. Some of them, for instance, may look feminized. Let me use that word.
Yeah.
They look rounded in their contours, and some of them may have smaller penises than is expected.
Only a genetic.
Genetic.
Okay.
And some may show absence of the growth of the pubic hair.
Wow.
When you get to puberty, your hair is supposed to grow at a certain rate for you to shave, shave. But they have, those issues. And some may not even have other secondary sexual characteristics. Their voice is not broken.
Wow.
They don't have the macho physique and all that. Some is show some breast, tissue. Yes.
Really?
Yes. So all these things can, in a way, indirectly point towards, but the majority of patients tend to look normal on the outside.
They tend to look. That's why you said yes and no. I see. But how can a boy experience puberty and yet wouldn't have all these? Is inherited or
yes? So there are certain rare syndromes which are associated with that. Kalman syndrome, Prader-Willis, Cartagenes. Fortunately, they are not so common. Now, those syndromes, you see, there are some who may be able to produce sperm all right, but they can have swimming problems.
Okay.
Some of those syndromes may be associated
so
with...
they are in that category?
Yes.
Okay.
Some of those syndromes may be associated with absence of those tubes, the valves that I talked about. So those tubes may be completely absent.
There.
They are not there. So you are producing the sperm all right within your testicles, but there's
no passage.
Exactly.
Okay.
Messi factory, one village, one dam.
One dam.
Okay.
Okay.
One village, one factory. Sorry. You are producing, but the road is poor. You can't move the pins out. Yes. So people are born, the tubes are simply not there. So all those syndromes are there, but like I said, they are in the minority.
They are in the minority. So it can run in a family.
It can.
It can.
Yes.
The ebusia, no name. Want to mention?
That is the beauty of, marrying across tribes.
Okay.
That is the beauty of it. There are certain societies in the world which are, should I call it, pure.
Okay.
Pure in quotes, in the sense that they don't marry people from outside the society.
Yeah.
The Jews, for instance, were noted for that.
Okay.
In the past. So a lot of inherited diseases tend to be very common among, among the Jews.
Among them. Okay.
Yeah. But the beauty of marrying across, so like myself, I'm Ewe, my wife is Ashanti, across.
Across.
It strengthens your genetic makeup.
Okay.
So that some of those gene issues
you will not pass it on.
Exactly.
Okay.
And your descendants tend to have a better, gene makeup.
Yeah.
Yeah. So I encourage people marry across. So that
marry across.
Yes.
Meant now.
We are the true Ghanaians.
No see that. I'm married across.
Those people who are married from their own tribe.
Yeah, well, messages, Kaka.
Sure.
We'll take them. Then we'll open the phone line. I want us to see to the messages. Last week, okay, so let's see. Good evening, please. Is there a solution for low sperm count? I'll go there. Dr. Tobo will take us through treatment. Maybe not today, but keep following the program. Hello, good evening, please. I am Kwame from Takrade. I have a question for Dr. Bernard. Please, doctor, I have married for 6 years. No child. My wife has been diagnosed fibroid and we have gone through surgery, but it has developed again. Okay, so infertility, baby.
So that's where it comes in.
Okay.
We advise that both parties are checked. So whilst the wife is getting herself treated, he should also be assessed.
So my name is Chairman Obwa inside Enyinam. Doctor, thanks. I must come and see you. Don't worry. He'll show you where it is.
Chairman, I'll wait for you.
Yes, he'll show you where it is. Don't worry. My wife was thinking I'm having a problem, so I've gone for sperm check. But she still indirectly thought I have fertility problems. Due to this pressure, I decided to go in for a girlfriend. I tried and the lady got pregnant. So now what should I do? Okay, so says your mom, Dr. Tobo, ne I'm not producing enough. Okay, I'm not producing enough sperm. Hello. Okay. All right, so I'm not producing enough sperm because during intercourse my deposit is just a few drops, and during the second round nothing comes at all, no matter how long I go or how. Can I be infertile? That is when obi atro buko member ono nezen me call my boy phone license. Yeah, the babu boom the man. Why ain't too many one? Don't worry, Dr. Tobo will be back to take care of your questions. So 050-815-6857. 050-815-6857. We are being refreshed by Baker's Hub. Baker's Hub, you can contact Baker's Hub on 0245-203-864. Baker's Hub on 0245-203-864. So she does fruit juice, she does all kinds of pastries. Hello. Hello, good evening.
Good evening, madam.
Hi, what's your name and where are you calling from?
My name is Joseph, calling from Ashawai.
All right, Joseph, go ahead.
I'm working in a greenhouse and there is a lot of heat. So I'm asking whether I have there is some side effects for me.
Okay, so he works in a greenhouse and there's a lot of heat in there. All right, thank you, Joseph. Dr. Tobo would answer that. Okay, so let me continue. It may be boom. So, hello, doctor. Please, how long can a sperm stay active in its place of storage after production? Kumi from Guru. If you have sex and the sperm comes out, is it good? Is it doesn't come out? I think he's trying to write. Hello.
Good evening.
Hello. Good evening. What's your name and where are you calling from?
My name is Kojo Dominic, calling from Kumasi.
All right, Kojo Dominic, go ahead.
Please, I want to ask the doctor a question.
All right.
I was diagnosed of varicocele.
Mm-hmm.
And then I went through a surgery.
Okay.
Before taking that surgery, my count was around 50 million.
Mm-hmm.
But after the surgery, I went for a semen analysis, and my count has dropped to 8 million.
Okay.
So I don't know why it should be so. And up to now, my wife hasn't conceived.
All right. So, Kojo Dominic, Doc would answer your question. Doc, Ade.
So
So let
me start.
Dominic. Yeah.
Like I said, on the average.
Another one, Kojo.
Okay.
Hello.
Hello. Good evening.
Good evening.
What's your name and where are you calling from?
My name is I'm calling from Eshi.
You're calling from?
Eshi.
All right. Capo, go ahead.
Okay, the problem is that if you have exopenia, and the semen analysis has shown that you have exopenia.
Okay.
What is the cost of the exopenia, and what will be the cure of the exopenia?
All right. Thank you, Capo. All right. So, Doc.
Okay, so let me start with the one who had a varicocele.
Yes.
Surgery. Ideally, after the surgery, we don't rush people to take their semen analysis.
Mm-hmm.
We give them about 3 months for them to take the semen analysis. That is more reflective.
Hello. All right.
Hello.
Hi. Hello. Good evening. Good evening, my dear. What's your name and where are you calling from?
I'm calling from Kumasi.
Kweku, can you please speak up a little bit for me?
Yeah, I'm calling from Kumasi.
All right, Kweku, go ahead.
Yeah. Please, every time I have sex, and the tempo on my penis, especially I'll see rashes on my penis. What is your thought?
You see rashes. Okay.
Yes.
When the sperm comes out. All right.
Yeah.
All right, Kweku. Thank you so much. Doc will answer.
So Kweku's woman probably may be having candidiasis.
Okay.
Yes, and that may be the reason for the rashes.
For the rashes.
Either candidiasis or another infection, so she should be checked adequately.
One be any na and then uncle.
Both of them.
Both of them.
So that you don't cause a fight.
All right. So Dominic.
Yeah.
The surgery after the surgery. Yes.
So I think he didn't mention the time frame, but if it is less than 3 months, he should take his time and then repeat it after 3 months. If it is beyond that, you know, the varicocele may not be the only factor. Some people may carry multiple factors. Either the varicocele is there and then there's infection, or there's blockade anywhere, and so on and so forth.
Okay.
Or low testosterone. So there may be multiple factors.
Hello, so that's my last caller. Hello. Hello, good evening. Oh, my last caller no call. Yeah, more facron count na. So
there may be multiple factors, and I'm happy the wife is also being checked. So he will need to be reassessed.
All right.
Yes. I wouldn't want to say that the surgery wasn't successful.
Wasn't successful.
Even though in some situations it may be like that.
Okay.
Yes.
So he needs to
be reassessed.
All right. All right.
Yes.
Now greenhouse.
Yes,
they
greenhouse
produce a lot of heat.
Yes. So that is another cause for worry.
Hello. Hello. Hello.
Hello.
Hello. Good evening.
Good evening.
What's your name and where are you calling from?
Yes, my name is Michael. I'm calling from Accra.
All right, Michael, go ahead.
Please, I've been masturbating for long and it's not affecting my marriage.
Oh, okay.
It also can affect my fertility.
All right. All right. So Michael has a peculiar problem.
Yeah.
All right, Michael, thank you so much. Oh, I need to come more. Minim sanke pepete baby sana sambia.
Well, no, maybe he can contact later, because when you go on the internet, they will tell you the good attributes of masturbation, but we frown on it because masturbation in general, I mean, makes you a selfish person.
Okay.
You have your own way of self-gratification. So when you go to your woman, there's no desire, so, and that addiction has to be broken. So his problem is mainly addictive.
Okay.
So he might need multidisciplinary help, not only from the urologist, but he might need a clinical psychologist as well. That will help to make him break that addiction. It's just like any other addiction. I'm sure with this, there may be pornography and other things associated with it. It doesn't make you want your woman.
Okay.
Yes, and it's not healthy.
All right, all right. So I'm sure Michael is still listening. Before we end the show, Dr. Tobo will put a contact out there so that you can contact him. Doctor, greenhouse nipane any name you?
Yeah. Greenhouse, yes, that is another issue of concern.
So where you work?
Occupational exposure. Occupational. I remember there was this seaman who used to work deep where the engine was. Wow. And anytime he came back on leave, the sperm count appreciates.
Wow.
Yes. The issue is, should you change jobs? In this era where there are no jobs. It's very, very dicey. But there can be some form of protection or you limiting the amount of time you spend in a greenhouse so that yes, you can have your sperms protected. Very, very important. Some people use reflectors, things that will not make you absorb so much heat. So you may want to look at that.
Okay.
The radical solution is him changing his job.
His job.
Yes. It's not so easy
as
that.
Some more. Obi Bisai. So far, we've not attended to the WhatsApp messages.
Obi Bisai said that.
What's a fibroid? My wife was diagnosed with fibroid, but as of now, one way still. She has gone through surgery.
Yes.
But I don't know if he has checked.
So he will also need assessment. Even a woman after the fibroid surgery, like I said, there are multiple factors. It may not only be the fibroid. Probably there may be hormone, issues, and so on and so forth. So once the mere fact that you've been checked before doesn't mean that we baby.
So anything can happen on the way.
Yes, so they may have to go for reassessment.
And I'm all kind there. You say why you mobile, but no wife in say.
You see, when Abraham went for Hagar, we are now having the issues in the Middle East because of that.
Yes.
I'll not advise him to go and terminate that pregnancy. He should keep it, but he should reinforce himself for the consequences that will come after that.
No. Obviously, I'm not producing enough sperm because during intercourse, my deposit is just a few drops. And during the second round, nothing at all. How long or how hard can I try?
So, you not producing enough sperms, it can be an issue of obstruction.
Okay.
And commonly it's infections which cause that. But like I also talked about, some people may be having most of the semen going
returning
the wrong way. Let me tie it down to the one who asked about the azoospermia.
Yes.
Where there is no sperm at all in the semen.
Yes.
The causes in broadly can be grouped into those due to obstruction and those not due to obstruction. So for the ones who have obstruction, infection is number one. And then those who've had surgery before, surgery around the genitals. That's why we always advise that, something as simple as a hernia repair should be done by a specialist. Somebody who is versed with those things. Otherwise, you can affect the tubes. They can get, entangled and all that thing. Once they go to the specialist, they understand the science behind the art. So they can do it very, very well. Then you have the non-obstructive ones, and some of them, like the genetic things that I talked about, and the things like the varicocele or torsion, mumps, that can affect the testicle and affect its ability to produce the sperm. So those are the broad categories.
Okay. Doc, baby, now me sure the watch and will contact. Your time so. I'll show you. It will contact be a bit between that to her.
What are you doing that?
My mini memo.
I will advise that they will call in the station and then you give it to them.
Okay.
Yes.
Okay. So you can call 0204 391417 after the show. So after the show, call 0204 391417. You get to speak to Dr. Tobo. All right, thank you so much, Dr. Tobo. Next week, I'll make questions in the big brave. You answer your discussion. So Dr. Tobo will be here next week. We'll continue. I know he's smiling. He'll come. He'll come. So stay tuned to ATV. He'll come and help you sort it out. So don't worry. You can contact Durwa GH. She's given the opportunity to become a professional makeup artist. It's free, totally free. 2 weeks free intensive makeup training. So you just pick your form of 100 Ghana. All learning materials will be provided. So the starting date is 18th November 2020. She's located at Kwabenya Pa Herbal Bus Stop. So you rush now. You can call 0202 319009. You can contact Baker's Hub for all juice and pastries. We are entering into Christmas, so book now. You can call on 0245 203 864. You can contact Acme Medical Laboratory. They are located at Odoko Ade Junction. You can call them on 05544000172. Contact Miss Foley for all your Christmas. Start booking now for all your Christmas costumes and designs, and she's a fashion designer. You can call her on 0544539655. She can easily come to your house. She does door to door. Come to your house, take your measurements, go and sew and bring it back to you, so you have no stress at all. My hair done by Time and Patience Salon at Kamara. You can come there and then you get to it. Thank you so much. Makeup in the mame yeah. The mame makeup. More applaud my ads. Makeup sponsored by Note Cosmetics. You can, they say, being notable. You can contact them on 055 160 6080. Keep voting. Voting ends this Wednesday, so I'll be here to announce that you keep voting, but we are hoping that Friday, because of your votes, we can win. Thank you so much for watching. I'm Na Edu. See you same time next week. It's bye for now.